So my name is Alex Lubarsky. I'm the founder of Health Media Group. I've been in and around healthcare for the last 20 years, over 20 years. And it is my great pleasure today to host Memory and Mercury. Hold on to your mind, youth, and teeth longer. I'm going to introduce you to our keynote speaker, Dr. Jimmy Kilimanjago, who is going to talk in a lot more detail the correlation between the oral cavity and some of the chronic conditions that people are experiencing. Dr. Jimmy Kilimanjago, who I'll introduce to you in a minute, welcome Jimmy, is a biomimetic dentist. He's the founder of ESI Healthy Dentistry in Smithtown, New York. Biomimetic means his focus is to mimic nature, and both structurally and scientifically. And that his goal is to optimize the oral cavity in such a way that it doesn't interfere with optimal function. Then we'll talk a little about the infrastructure of our current model of healthcare, which is today entirely focused on the indefinite management of chronic disease, or all $4 trillion of it. So the more money we spend on the management of disease, the more profitable disease becomes. So inadvertently, we made disease a modern day gold rush. So we'll talk a little bit about that. I'm going to tell you about my friend Gene Scala. Last I saw him, he celebrated his 107th birthday. When I first met him, he was 105. And even at 107, he was bowling every Wednesday. He made his own clothes, as you can see, and he played the saxophone. He was also very popular with the ladies, 80 and up. And he was a very sharp, very, very funny, light-spirited man who lived a very long time. So we're going to talk about longevity and the opportunity that it offers to extend our life, yes, but more importantly, condense the time that we deal with diseases of aging. So also, I'll introduce you to Integrative Genetic Solutions, which is a breakthrough technology in diagnostic testing. Basically, what it does is it takes all available information on what it takes the human body to function optimally, and then correlates that with a person's blood work. So it provides a very thorough report of any deficiency, toxicity, inflammation, food allergies from the DNA out. So it gives us a very clear understanding of what the person is dealing with, and then help them optimize all of those levels, all of those markers. And when you focus on optimization rather than the management of disease, the results, I think, are much better. We'll talk about deficiency and toxicity, and specifically vitamin D, knowing your vitamin D level. I think it's crucially important, and I'll talk a little bit about some of the effects of having low vitamin D and depleted vitamin D. And ultimately, if you don't know your vitamin D level, chances are it's very low or depleted. And then I'm going to give away a copy of this book as a gift to one of our participants. Dr. Jimmy will choose the winner. This book is awesome, The Science and Technology of Growing Young by Sergey Young. It talks about the future of human optimization care and how modern science and breakthrough technology will allow us to get past all of this disease management medicine that profits from chronic conditions. And there's a lot of perverse incentives in our current system that get people, doctors who might be carrying deep inside their soul, to behave in a way that doesn't really benefit the client. Because, well, the patient, let's say, the client is really the insurance company. So let's talk a little bit about our healthcare system and the inherent problems with it. Right now, the average person is spending about $2,000 a month paying for their health insurance, whether it's coming out directly out of your pay or it's siphoned from income you could be making. That's pretty much what the cost is. I have a friend of mine that runs a company on Long Island. He pays $33,000 a year with a $2,000 deductible per family member. So that's a tremendous amount of money to pay for something that you can only access, your doctor can only access the money you pay into this system once you're already diagnosed with some kind of a chronic illness. He cannot use it for prevention. He cannot use it to alleviate chronic illness, to get to the root cause. That's not how it's structured. Its only structure is to wait until you develop a chronic illness, once you cross that threshold, and then to manage it with Band-Aids and aspirin and surgery and hospitalization for the rest of your life, medication and like that. So I am personally not interested in that kind of medical care. Right now it's at $4 trillion, it's growing geometrically, and you saw it in the current, over the last 2 years in this current environment. You know, how many times have we heard that we need a vaccine and we need a mask? But how many times do we talk about optimizing your vitamin levels, making sure you have enough vitamin D, making sure you take enough vitamin C, making sure you adjust your nutrition, making sure you get rid of as much sugar out of your diet as you possibly can, because sugar suppresses your immune system. We didn't hear anything about it. So the current model of healthcare is mostly outside in, and it doesn't really trust or believe that the human body has the capacity to live optimally if it's given the proper environment to do so. Gene Scala, like I said, last time I saw him, he was celebrating his 107th birthday. So human longevity, if we, rather than focusing on the management of chronic disease once it evolves, actually focused on longevity. And today we have the science and technology to be able to do that. If we can combine the science and the technology that we already have, all this DNA research that we're doing, and allow the AI to kind of search through this tremendous amount of information that we're gathering in the medical field, and start focusing on how do we get the body to produce better cells? Because ultimately, when your cells are functioning well, you're going to be functioning well. When the cell begin to die and transform into malignant cells, that's when we start running into problems. So if we can provide the cell all the raw materials necessary to function optimally, then we can live longer. But ultimately, I ask people, you know, if you could, would you want to live to be 120? And most people that I talk to, they say no, they don't want to live to be 120. There was a woman in France. She was 90 years old, and her landlord, who was also her attorney, wanted to buy her apartment. So he said, I'll give you a bunch of money down and I'll pay your rent. And once you pass on, you know, you're 90, then I'll just take over the apartment. So she agreed to the deal, and she ended up outliving him by 2 years. She lived to be 126. And his wife ended up paying her another 2 years before she passed away. So it's very possible to live a long time. But would you want to be 120? I ask people, and most people say, no, I don't want to be 120. But it doesn't really matter if you live to be 100, 120. If we focus on the longevity and then shrink that window of age-related disease into a much smaller fraction, then what does it matter if we live to be 100 or 120? If you're optimally well, if you're enjoying life, if you're having fun, you're the center of attention because you're so old and so cool and so wise. I think there's a lot to be said about longevity as a positive goal that we can set for ourselves. So Integrative Genetic Solutions is a really interesting company. It was founded by John Orban. John ran one of the largest bank optimization businesses in the country. And when he was in his mid-30s, he was racing his bicycle and got hit by a van. He ended up in the hospital for 30 days with 13 bolts and screws on the left side of his body. When he came out, his health started to spiral downward. So brain fog, chronic fatigue, poor sleep, weight gain, all of these things. So he went from doctor to doctor to doctor, trying to figure out what is the underlying cause of his issue. And the only thing they can offer him is medication to suppress the painful symptoms, medication for better sleep, medication for weight loss. Eventually, he stumbled onto a doctor who is considered one of the top human chemistry experts in the world. His name is Dr. Richard Lee. Dr. Richard Lee, of course, does not accept health insurance, and he was very expensive. But 8 months later, working with Dr. Lee, Jonathan felt like his old self, so much so that he began racing his bicycle again. And he said, listen, this is great, but it costs a fortune and it takes forever. The average person will never be able to afford this kind of personalized care. Why don't we create a computer program that takes all available information on what it takes the human body to function optimally and then correlate that with a person's blood work? It creates a very thorough report of any deficiency, toxicity, inflammation, food allergies, any potential things that you might be prone to based on your DNA. And then we're going to look to optimize this person by providing the body everything it needs to function optimally. So they created this program. I put myself through it. First time was 6 years ago. And they just went into business that year. So there was a lot of bugs in it. It was a lot problematic. But I put myself through it, and it showed that my vitamin D was non-existent. My testosterone was low. I wasn't absorbing vitamin C. My estrogen was high. I had heavy metal toxicity, a whole bunch of food allergies, a bunch of things going on. So once we started optimizing me, within a month, the first thing that happened was my brain fog lifted. And I was walking around for like 2 years thinking, I can't think straight. I forget stuff. I can't tap my creativity. I just thought it was a normal part of aging. And then my energy came back. I was chronically fatigued. I was sleeping 10, 11 hours a night, but then I'd walk around like a zombie throughout the day. And my energy came back with full force. I had so much vitality. It was amazing. It was like being a kid again. And then I dropped 20 pounds that I gained over the last couple of years, and I couldn't lose no matter what I tried. But all of a sudden, I just dropped this weight, and I went back to the weight that I've been my entire life, mostly. So it was a remarkable transformation, and it just shows what the body can do when you provide all the important nutrition for it to function optimally. So let's talk a little bit about vitamins and minerals. There are 90 essential nutrients that your body needs to function optimally. There are about 60 minerals, 16 vitamins, 12 amino acids, and 3 fatty acids that you need to function optimally. And so there's no way for us to know where we are with any of these vitamins or minerals, if we're depleted, if we're not depleted. And then there's also the toxicity level. We're exposed to so much mercury that Dr. Jimmy is going to talk about because of amalgam fillings and because of the fish we're eating and the environment. Then there's parasites, there's mold, there's plasticides, there's all this toxicity that we're exposed to. And when we become depleted in certain nutrition and toxic with other foreign substances, then the body begins to exhibit symptomatology. So vitamin D testing, let's just talk a little bit about vitamin D because I just think it's so important. The medical system says that, if your vitamin D is over 20 nanograms per milliliter, that you're good. But what does that mean, over 20? Is it 21? Is it 50? Is it 100? No, over 20. But if your vitamin D is under 15 nanograms per milliliter, you're in a very high risk of developing rickets if you're a child, and osteomalacia if you're an adult, which are bone diseases, if you know. Under 20 nanograms per milliliter, you have a 75% chance of developing colon cancer. Isn't that incredible? If your vitamin D level is below 20 nanograms per milliliter, there's a 75% greater risk of developing colon cancer. So I think that's remarkable, because if, God forbid, someone is diagnosed with colon cancer and they go to the hospital and they do the surgery and they do the chemotherapy, and I've known people, and I've asked them this question: did anybody ask you about your vitamin D level? No. Anybody talk to you about your nutrition? No. So the system is set up to manage chronic disease, but not to prevent it, because to prevent it is money lost. I hate to be so cynical, but that's what it is. If you're under 30 nanograms per milliliter, you have an increased calcium loss from the bones. You can develop osteoporosis, you have poor wound healing, increased muscle pain, joint and back pain, greater risk of depression, diabetes, schizophrenia, migraines, autoimmune diseases, allergies, inflammation, so many other different things. If you're under 40 nanograms per milliliter, you have twice the risk of heart attack, increased high blood pressure, and 3 times the risk of developing multiple sclerosis. So under 40 is not sufficient. 50 to 80 is where vitamin D becomes more optimized. Over 50 nanograms per milliliter, you have a 50% reduction in breast cancer. So it's funny, like all my friends, I'm over 50 now, not breast cancer for me, but they all want me to go do colonoscopy, you know? They're on me. Over 50, you have to do colonoscopy. But first of all, I want to make sure that, but nobody tells me, Alex, you got to make sure your vitamin D is over 50 nanograms per milliliter, 50 to 80. Nobody talks about that. But if it's over 50, 50% reduction in breast cancer and decreased risk of all solid cancer between 50 and 80. But if it's between 80 and 100, you can actually slow cancer growth if someone is already diagnosed with cancer. I think that's amazing. So why wouldn't you want to have your vitamin D, knowing this, between 80 and 100 now? I just actually had my blood work done, and I'm happy to report my vitamin D came back as 180. That's probably a little too much. My doctor was a little concerned about that. So I'm going to drop it to about 100. I want it on the high side of the extreme, rather than the low. So now I'm going to introduce you to our keynote speaker. All right. Our keynote speaker graduated from the State University of New York School of Dental Medicine in Stony Brook in 2002. He graduated magna cum laude from Adelphi University, attended a 1-year oral implantology program at NYU College of Dentistry. He attended a 2-year orthodontic continuum at the United States Dental Institute. He's the associate clinical faculty at SUNY Stony Brook School of Dental Medicine. He has extensive experience in sedation, implant surgery and restoration, as well as Invisalign, children's dentistry, single visit crowns, porcelain fillings, laser dentistry, biomimetic, cosmetic, and reconstructive dentistry. Our guest is a diplomat of the American Board of Oral Implantology, past president of the Suffolk County Dental Society, and before becoming a dentist, a biomimetic dentist, Dr. Jimmy was a chef for 7 years, which allows him to combine nutrition and oral care, which work together very synergetically. He's the founder of ESI Healthy Dentistry in Smithtown. It is my great pleasure to introduce to you Dr. Jimmy Kilimanjago. Welcome.
Alex, thank you so much for that introduction. I'm going to try to share my screen whenever we can. Very good. Thank you for that. All right. Well, I'm glad that you guys were able to join us tonight. Alex has shared some really powerful information about healthcare and our health system. So I'd like to kind of continue on that theme, only through a dental prism. So I hope that you get a lot of great information that you can use right away. When we're looking at, bear with me for a moment. When we're looking at dental issues, a lot of people are frustrated, and they're asking me this question that you see on your screen, like, why me? Why do bad things happen to me? I have bad teeth, I have soft teeth, I have bad gums, and they compare themselves to other friends and relatives where they don't have any issues. So it's definitely a frustrating thing when you're having issues with your mouth that you can't really explain why you're having them. And no matter how hard they try, they have these issues. Is it because of genetics, or is it because of the environment? If we were to kind of oversimplify dental and medical issues, they're definitely related. And you see some of them here, inflammation. And you see inflammation in the mouth, but you also see it in the body. And I like to look at the mouth as a portal to the rest of your body. So we'll talk a little bit about that in a little bit. So you know that you have inflammation in the mouth. It can translate itself in the rest of the body. There's microbe imbalance in the mouth, which can in turn affect the rest of the body. We know that the mouth is attached to your GI system. So like we were talking about earlier, whatever you're eating can affect your oral cavity, but it obviously can affect the rest of your body. Because if you're putting good things in, good substances in, like we heard Alex talk about, vitamins, nutrients, minerals, then they can go to the right organs so that you can be healthier, so that you can be optimized. And all these things are related, interrelated, dental and medical, like acidity level. What does that mean in the mouth? What does that mean in your GI system? What does that mean for your skeletal system, your bones? Bone integrity, right? They're all tied together. Immune function, right? A lot of times we're thinking, okay, I need calcium for my bones, but it also helps your immune system function properly. Vitamin D, same thing. It's good for your bones, but it's also good for your immune system. So everything is really interrelated. Same as cardiovascular health. When you look at the oral cavity, it's a very vascular area of the body. It's pink because of all those small little blood vessels, capillaries, venules, veins, arteries, arterioles. So whenever something is good in the mouth, it can be absorbed and go into the rest of your bloodstream, which in turn will go into the rest of the body. If you have bad things like toxins, they can go into the rest of the body just as good. Brain health is also very important because if you're having some issues in your gums, those like plaque, for example, or toxins, that can go into the bloodstream. And if it goes into the brain, you can have a TIA, which is like a mini stroke. It can also affect your mentality, right? Your psychological health. So we'll talk a little bit more about that in a little bit and how it ties in together. Digestion is the obvious one, because we know that the mouth is a portal to your digestive system. When you're chewing things, you do have salivary enzymes that break down those early foods that we're having. For example, if you have a pretzel, it might taste salty in the beginning, but if you keep it in the oral cavity for a while, it's going to start tasting sweet. Why? Because you have these enzymes that break down these complex carbohydrates into simple carbohydrates, kind of like sugars. But the mouth is also a portal to the circulatory system. Like we were saying before, very vascular. If you need emergency drugs, you can actually put them sublingually or underneath the tongue. One example is angina, which is chest pain. In order to increase blood flow into the heart, you would take nitroglycerin, you would put it under the tongue. This way, it goes immediately into your bloodstream and it opens up those blood vessels so that you don't have chest pain, so that you have more perfusion of the cardiac muscles, the heart muscles. The mouth is also a portal to the respiratory system. A lot of times people are mouth breathers. They breathe through their mouth at night. They'll wake up in the middle of the night with a very dry mouth. They need to take sips of water. So as you have bacteria and plaque in your mouth, if you take deep breaths through your mouth, what happens to that bacteria? It actually can go and colonize into your lungs and it can cause lung infections, upper respiratory infections. It's also a portal to your immune system. Okay, I mean, you've heard of the phrase licking my wounds. Well, you have animals that if they have wounds, like a cat or a dog, they will lick those wounds. Why? Because we do have enzymes and immune cells in our saliva. So now we're actually speeding up that healing process. These are some dental diagnoses, right? When we have dental issues, these are some dental issues that we see in the mouth. Caries is fancy for cavities. And it's a combination of bacteria, saliva or lack thereof, and pH or acidity. And that's when the mineral of the tooth breaks down, and that's how you develop these cavities. So if you have good oral hygiene, if you don't have frequent snacking, if you have a well-balanced diet, you can eliminate this disease. Incidentally, this disease does not really occur in nature. Right? So if you have a tiger in the wild, they don't have decay. Why? Because of their diet. They don't have simple carbohydrates. They have protein for the most part and fat. So, and they don't snack frequently. So that literally does not exist in nature. It's kind of like a man-made thing. Metal toxicity. I'll talk to you a little bit about what bad things can happen with metal toxicity, specifically amalgam, which is a mixture of different metals, 50% of which is mercury, which is a really potent neurotoxin, arguably the most potent naturally found neurotoxin. Bruxism is grinding or clenching. A lot of us have heard of the term TMJ. It stands for temporomandibular joint. Now, everybody has a temporomandibular joint. It's a hinge that opens and closes your mouth, but there's something called TMD, or temporomandibular disorders. And it could be muscular, it could be bone related, it could be ligaments, it could be neuromuscular, right? Where you have hyperactivity of the muscles, the nerves are firing. And many times that's also an artificial thing where you have two unlike metals in the mouth that cause almost like a battery. We'll talk a little bit about that in a few minutes. How about fractures, right? Why do we have teeth that are chipping? There has to be some kind of imbalance. Is it hyperactive muscles? Is it an interference of tooth contact where not everything is balanced? Is it misalignment of teeth where it causes this interference, right? So there's many different reasons why we're having fractures. We should not have fractures in our teeth unless it's an accident. What about erosion? When you look at some of these teeth here, like this middle picture, you have this scooped out, cleanly scooped out phenomena only on the inside of the teeth, not on the outside. So that is a chemical thing. It's a acidic thing. But why is it only from the inside and not the outside? This is actually a bulimic patient, a patient that binges and purges, right? Eats and then induces vomiting. So the hydrochloric acid from the stomach actually goes from the inside out and wears away the enamel. So if you're looking at these pictures here, you can play detective and figure out why are we seeing these issues? Why are we seeing these pristine lower teeth on this young child, but rampant decay on the top? Well, this is called bottle rot or nursing bottle caries, where the tongue covers the lower teeth and the child is using a bottle with milk, which has sugar in it, with orange juice or something like that. And it constantly bathes the teeth in carbohydrates, simple carbohydrates, throughout a long period of time, right? High frequency carbohydrates, not giving the mouth a chance to rebound that pH and getting it into a more alkaline pH. So this is the perfect storm, and you're having rampant caries here, rampant decay. This is bruxism, right? Which is basically clenching or grinding over a long period of time. But I also noticed that there's no back teeth. So we're overloading the front teeth. So like I said, you're playing detective when you're looking at these issues. This is called meth mouth. When patients are abusing recreational drugs, what happens is they have no interest in eating healthy. They get really hungry at certain times during the day, oftentimes late during the day. They eat easily found food like fast food, rich in carbohydrates. And what happens is the mouth gets really, really dry. So now you have less saliva in the mouth, a lot of carbohydrates, lack of oral hygiene. And again, this is like a perfect storm where every single tooth has a cavity. Attrition is grinding, like you see here. And sometimes you have pathology like dental infections. So let's talk a little bit about mercury and mercury toxicity. As I said earlier, these amalgams, which is basically a mixture of different metals, are predominantly mercury fillings. And we used to think that these are safe to use, and still to this day, the American Dental Association guides us saying that it is safe to use, but in 20 countries in Europe, it is actually illegal to place mercury fillings in patients' mouths. So the other thing is that the Environmental Protection Agency says we cannot throw these amalgams in the sink, in the garbage. It has to be done a certain way. It has to go through a specific chelating process. We spend in dental offices, we spend a lot of time, money, and technology to harvest these things safely so that we can pay money to dispose of it safely. So the Food and Drug Administration says it's safe to use, but the Environmental Protection Agency, EPA, says it's not safe to discard it in the environment. So there's a little bit of a disconnect there. I know that these amalgam fillings, they expand and contract throughout time. So they actually cause a lot of problems like microfractures and leakage around teeth. So they may last a long time, but at what expense? At what health expense? At what expense to the tooth? Is it going to break the tooth and then we're going to have to take it out? Or is it going to break the tooth and we're going to have to use something like a crown to save that tooth? Or does it need a root canal after that? So I'm a little leery. I haven't been using amalgam since dental school. So in practice, I haven't really used amalgam because I think that some of this mercury can leak. And although some people may not be sensitive to it, some people are very sensitive to a small amount of it. So if some of this mercury vapor is oozing out as you're drinking a cup of coffee or you're having something hard or crunchy, what happens when you're exposed to this mercury and you're inhaling it, right? The vapors are more of my concern than the solid metal, right? Because the solid metal is not mercury, it's the vapors that come out of these fillings. And as I said before, mercury is a highly toxic material and it causes all these issues here. So when I look at these things in this list, like anxiety or irritability, tingling, numbness, not feeling up to par, having this brain fog, you're sad all the time, you're depressed, you can't remember things, your hearing is impaired, you have tremors or muscle aches or muscle spasms, you have impaired speech, you're constantly tired, you can't really get a good night's sleep. Sometimes it could trigger autoimmune diseases, which I'll talk about in depth. Is this mercury toxicity or is it just my personality? I can't help but wonder, right? Galvanism is what I alluded to earlier, where you have two unlike metals, and then you have a solution, namely saliva. And as this conducts electricity, it acts almost like a battery, like a minor battery. In the old days, as kids, we used to play around, take a 9-volt battery and put our tongue to the two poles, and we get this little zap. And that's 9 volts of electricity, right? So even if it's less than that, like 1.5 volts, which oftentimes has been measured inside the mouth, what does that low voltage do over a long period of time, throughout the whole day, throughout the week, throughout the month or months? Does that cause little twitches that we're not even aware of? Does that cause hyperactivity or firing of nerves? Where is this imbalance happening and what does it entail? That's what I'm really curious about, right? So a lot of the things that I've talked to you about before could be caused by something like this. There's other problems in the oral cavity, like periodontitis, which is probably the #2 most prevalent disease in the country. And it's kind of like you have some diseases and you have periodontitis, right? Which is gum disease that causes bone loss, and we'll talk more about it. Bad breath, is that really just an aesthetic thing that I'm kind of conscious of it, or is there an underlying thing? Is it coming from your lungs? Is it coming from your GI system? Or is it just coming from topically your mouth? Missing teeth. Let's face it, God didn't create us with 32 teeth for no reason. There has to be a reason why we have those teeth. In order for you to function optimally, you need a full complement of teeth. Can you function without teeth? Yes, you can. Can you function without a hand? Yes, you can, but that's not optimal, right? So in order for you to function properly, you need a full complement of teeth, because once you're missing certain teeth, it is kind of like missing a finger or two. It's kind of like you're a dental amputee and you compensate. Yes, you can still function, but there's other consequences, right? There's other sequelae that happen because of those missing teeth. Candidiasis is another issue, like fungal infection. Anytime you have a microbe imbalance, certain things overpower. If you have less of certain bacteria, these fungal organisms overpower, and then they create this candidiasis. Xerostomia is dry mouth. Not normal, right? Oral cancer. I'll talk to you a little bit about oral cancer prevention, oral cancer screening, and how we can prevent things. If you catch things super early, you can actually cure oral cancer or not allow it to develop and manifest itself in the first place. Misalignment of teeth. There's other health consequences when your teeth are not meeting together properly, when you don't have a healthy bite. It's not just aesthetics. It's about proper function and chewing your food properly. I want to spend some time talking about autoimmune diseases. As many of you know, an autoimmune disease is when your immune system is turning against itself. We do create certain toxins, certain endogenous toxins that we create on purpose so that we can kill microorganisms. But what happens is those toxins, when they go haywire, when we create too much of them, not only kill bad things, but they also kill good things. They also damage our own cells. Essentially, what happens with these autoimmune diseases is we create specific autoantibodies, right? So that we can detect our own healthy cells and kill them, right? It's kind of like immune cell civil war. Now, is this genetics or is it an environmental thing? We know that there's a genetic predisposition. People have a family history of it. They inherit it from their parents, grandparents, and some people are just simply pre-programmed and destined to have these immune diseases, autoimmune diseases. If you do a specific DNA test, you will figure out if you're a carrier or not. So we cannot dispute the fact that these are genetic diseases. However, does the environment have a crucial role in it? The answer is yes. Some people are exposed to these environmental triggers or nutritional triggers that turn on these autoimmune diseases. Some oral triggers are oral infections, bacterial imbalance, microbe imbalance. And those things can trigger autoimmune diseases, as you see here on this list. For example, diabetes or Crohn's disease, among other GI diseases. Lupus, pemphigus, lichen planus. Many of these are skin disorders or can manifest themselves on the skin. Sjogren's syndrome, which affects many of our glands, sweat glands, salivary glands, right? So yes, there's hereditary issues. Yes, we have white blood cells that can be affected. Your lifestyle, like smoking or drinking, some hormonal influences, environmental factors, they all come together and they cause these issues that are autoimmune. So we have genetics and we have triggers. Genetics, such as DNA mutations that cause us to be predisposed to these diseases, and these environmental triggers that will turn these on. Well, conversely, without those triggers, those diseases stay quiet and they're never expressed. That's basically a way to cure that disease, or if it's not expressed, it's almost as if you don't even have it. Yes, you're a carrier, but you're not really expressing it. So I mentioned oral infections. Tooth decay is indeed an oral infection. It's caused by a bacterium or a group of bacteria called strep, right? Like Streptococcus mutans is the one that specifically causes decay, tooth decay. So we know about strep throat, right? When strep infects the throat, it's an infection, and we use antibiotics to control that infection or eradicate that. I'm not suggesting we use antibiotics in the mouth to address this mouth infection, because we have more biomimetic, bio-friendly ways of doing it. But essentially, cavities are a mouth infection. It's like strep mouth, if you will. And those oral infections can trigger these autoimmune diseases. Gum infections can also turn on these immune diseases. And they also have a genetic and an environmental trigger, just like autoimmune diseases. Essentially, when you have these aggressive anaerobic bacteria, they start this periodontal disease. And obviously, lack of oral hygiene can also be a trigger. So if it gets exacerbated by poor oral hygiene, you have these bacteria that are anaerobic. They don't like air, they don't like oxygen, so they hide into nooks and crannies of your gums or your tongue, inside your oral cavity, and they slowly cause inflammation. Why? Because as these bacteria are creating these toxins, it establishes this host response, this inflammatory response. So you're recruiting these immune cells, and they're trying to wall off this infection. They try to stop these intruders from entering the rest of your body. However, once it reaches a certain threshold, inevitably it will enter the rest of your body because it will go into your bloodstream. So you've heard of plaque, dental plaque. which is very, very similar to this arterial plaque, right? Where you have plaques on your blood vessels, same type of plaque in your mouth will cause a decrease in your diameter of your blood vessels. So now what happens? What happens when you have a garden hose and it's a brand new garden hose? The water just flows out. But if I squeeze that, right, kind of like plaque on your blood vessels, it increases the blood flow, right? It makes it more turbulent, it's faster, the pressure of it is more pressure, like blood pressure. If you have plaque on your arteries, what happens? The diameter is smaller, you're increasing the pressure on those blood vessels. That's not good, that's not healthy. So I hope that you can kind of see the connection between the oral cavity and the rest of the body. I'm picking on the cardiovascular system for the time being. But earlier we were talking about neurovascular, kind of like mental issues, right? With mercury toxicity. So, but let's go back to periodontal disease. You know you have a predisposition to systemic disease because now you have this chronic inflammatory response in the mouth that entered the rest of your body. And it started in the mouth, and you basically started an inflammatory biased immune system. You're training your immune cells to be inflammatory biased. So now these cells are hypersensitive. Anytime you have a little bit of inflammation or a little toxin or a little intruder, your body just creates this overabundant immune response. And you have this chronic inflammation that constantly happens in the rest of your body. Your GI system, your brain, your cardiovascular system, your heart, your spleen, all these organs, your liver, your kidneys, right? So it's not just in the oral cavity. It started in the oral cavity, but now every organ is inflammatory biased. And you have progressive tissue breakdown, not just around your gums and your teeth, but in the rest of the body. So your ability to repair damaged tissue is diminished. So again, it starts in the mouth. Gum tissues are constantly being bombarded and challenged by bacteria. So if you don't keep your oral cavity healthy, you're having other systemic issues. You're having these pro-inflammatory mediators and cytokines that are constantly free-flowing in your bloodstream. What does this mean? This is kind of like the walkie-talkie between cells. It's the way they communicate with each other, right? That's how they're saying, hey, we have inflammation in this part of the body. Hey, we have inflammation in the other part of the body. So now your immune cells are going all over the place. They actually produce insulin resistance. What does that sound like? Insulin, diabetes. So now you have another autoimmune disease that gets triggered, all from a dental infection, right? So we know that gum disease is an infection in the mouth that makes you more prone to have diabetes. When you have diabetes, you're more prone to getting gum disease. So it's kind of like, which came first, the chicken or the egg? Your gum disease can lead to higher blood glucose in your sugar, right? Higher blood sugar. So you're having high blood sugar, it makes your diabetes worse, it makes your gum disease worse. So it's a vicious circle. Periodontal disease. 1 out of 4 diabetics have periodontal disease. When you have poor blood glucose control, it makes your gum disease worse. When you have worse gum disease, it leads to poor blood glucose. See, it's a cycle. And then you're having diabetic complications. These are some of the diabetic complications that we have. Poor wound healing, higher risk of infection. Diabetics are notorious for that. The obvious things, problem tasting food, less salivary flow, a lot of poor food selection leads to cavities. It leads to more inflamed and bleeding gums, which eventually leads to tooth loss, mouth sores, bad breath, everything, it just goes haywire. But diabetics, unfortunately, suffer from all of these things. Brain issues, neuropathy, kidney failure, heart disease, retinopathy. So we have inflammation in the mouth, but it goes into the rest of the body. It's beyond the mouth. When you have inflammation, in general, it interferes with nutrient absorption, right? You constantly have this chronic inflammation of your guts. You can't absorb these nutrients. So if I'm here preaching to my patients, you need more calcium, you need vitamin D, you need K2, right? Vitamin K2. They're taking it, but they can't absorb it. If they can't absorb it, it can't go back into the mouth. It can't go into your teeth. It can't go into your gums, your connective tissue, your bone. So you're having continued bone loss, continued gum degeneration, collagen breakdown, which basically affects the ligaments that hold teeth in the bone, and exacerbation of this biome imbalance. Well, you got to be able to see it so you can treat it. If you can't see it, you can't treat it. It all starts with advanced diagnostics. And almost everybody right now, all dentists have digital radiography. Every system is a little different, but digital radiography was a great technological advance because it cut down radiation by 90%, which is really, really profound. But it goes beyond digital radiography. Intraoral cameras are kind of like little pen cams, small little devices that can go into the mouth and can take pictures, as you can see here. And there's different modes. You can adjust the light source so that you can see different things. You can see hidden cavities, as you see on the upper left-hand side here. You can see hidden plaque that you normally wouldn't be able to see with the naked eye. And when you're able to see it together with your dentist, now you can make a co-diagnosis, right? It's not just the dentist preaching to you. Now you can see it and you buy into it. Transillumination is when you're flooding the tooth with light. And if you have a device that can capture these images, you can see small little areas of demineralization, or areas where it's like almost the beginning of the cavity, because the cavity doesn't just appear like that. It starts by slowly breaking down. So if I can catch it early and I can visualize it, instead of me drilling on it, I can actually remineralize. Okay, so if it has less mineral and it's starting to break down, let me catch it early so that I can give you something like a paste with calcium phosphate, and now you can remineralize, you can strengthen that. How cool would that be, right? Biologically treating the cavity super early so that you don't have to get a filling. Obviously, periodontal exams are crucial. Velscope is a very interesting technology where it uses fluorescence, and as it has this blue light, it bounces back and you can see if there's something suspicious. For example, with an unassisted view, you can see the mouth and it looks normal, but with this assisted view, this enhanced oral cancer screening device, you can see that something's hiding underneath that you normally wouldn't be able to detect. So again, if I can catch something super early, something that's suspicious, or we call it dysplastic, dysplasia is like not normal, not cancer yet. Well, I'd like to catch that super early so that I can address it and cure it. If I do see something suspicious, I can use a brush test or a brush biopsy, where I literally take this brush and scrape some cells, send it to the microbiological lab. They can look at it under a microscope and they can tell me, don't worry, it's just a callus. Or they can say, this is not acting properly. It's acting weird. You should look into it. One piece of technology that I'm super excited about is this three-dimensional cone beam CT scan. Think of it as a dental scan. You know what a CAT scan is, you know what an MRI is. This is something specific to the head and neck area, right? However, it's literally 1% of what radiation you would have from a regular CAT scan, because a medical CT, it basically takes like little laser sections, right? If you do an area from, let's say, your mid-face to your lower jaw, it might take 1,000 slices of it. This one is kind of like taking a flashlight, not a laser, but a flashlight, and just panning through once. So it takes 16 seconds, a lot less radiation, but now you can really dive into it and see exactly three-dimensionally what's going on with these teeth. Let's take a look at this white line here. This is a root canal treatment. And a root canal treatment is not just like a perfect cylinder. If you take a cross section, you can see that every single tooth is different. Even one tooth, if you take different sections, has very different configurations. Little fins, little crypts, right? Little tiny little tributaries. Think of a river. A river is not perfectly symmetrical. Sometimes it gets a little wider, sometimes it gets skinnier, sometimes it splits, sometimes it has a tiny little tributary or a stream. Well, the same thing happens with these canals. This is a root of a tooth, and it's hollow on the inside, and it has that little river that I was kind of alluding to. So if you do have a tooth that has a hidden tooth infection, is it on the outside? Is it on the inside? Is it to the right, to the left? This is kind of a GPS where I can literally find exactly where it is, so I can go in there and minimally invasively treat that. It's a microsurgical procedure or a non-surgical procedure. That, again, if I can't see it, I can't treat it. Now with this technology, I can see it. And the key thing is you don't want to be walking around with a hidden infection that's kind of nagging your immune system. You want to walk around with your immune system only having to focus on the absolutely necessary things, okay? Every day, we're challenged by DNA mutations, and we repair them. We don't even think about it, right? We don't even know about it. So that's what I want your body to focus on, not some hidden dental infection. Because when you repair these DNA mutations, you're literally kind of preventing cancer from happening. If you are bogged down with dental infections, you're neglecting this DNA repair, and you're allowing DNA mutations to occur, and that can cause cancer. Let's talk a little bit about more advanced diagnostic techniques like diagnostic lasers. Sometimes you look at a tooth and it has a little stain on the top pit of it. Well, is that just a stain, or is it the beginning of a cavity? I'd like to find out if I can just quantify this and say, okay, give me a scale, all right? Is it 1 to 10? Is it 10 to 50? So we use these diagnostic lasers that almost act like sonar and can tell us if we need to just keep an eye on this tooth or if we need to open it up and do a tiny little sealant or tiny little filling. I like tiny little fillings better than big fillings, right? So if I can treat something super early, it's quick, easy, painless. Something that's low tech, but very, very important is a salivary analysis. As I'm resting right now, I'm producing saliva. I'm talking, right? There's some friction around my oral cavity, tongue, lips, cheeks. So we need to produce saliva to lubricate those tissues. As we're resting, we should produce a certain amount of saliva. There is too much and there's too little. What is the pH of it? Are you normally walking around with a very acidic pH? Well, then you're probably more prone to cavities. Is it very, very thick? Is it very, very watery? What is the viscosity of it? If I challenge you with something acidic, like a piece of candy, for example, what is your buffering capacity? Can you buffer that and balance it out with more alkaline pH? How long will that take? Do you have enough stimulated saliva? So those are very rudimentary, basic tests that we can do, and we can play detective and figure out why you're having issues, why you're having bad breath. Maybe you're having one of these things might be a little off. And then one of these things could be off and cause a microbiome imbalance. I'm all about biomimetic technology and advanced treatments. Like I said before, I don't like giving people antibiotics. If we do have a dental infection, maybe we can use biology and technology to offset it. Maybe we can oversmart or outsmart the system. For example, oral probiotics. Many of you are taking GI probiotics. These are oral probiotics. These are bacteria, freeze-dried bacteria, that are harmless. And when you're putting in the mouth, it basically reactivates them. So now you have these harmless bacteria that are competing for the same nutrients that harmful bacteria are competing for, therefore balancing things out. Not that you're starving the bad bacteria and you're allowing the good bacteria, but just balancing it out. It's literally ecology. Think of a pond or a lake. You have good bacteria, you have mosquitoes, you have microorganisms, you have fish, right? You have flora. So everything's in balance. That's what we're looking for here. And there's different types of oral probiotics. So if you're more prone to decay, let me give you this probiotic. If you're more prone to bad breath and periodontal disease, let me give you that probiotic. So now you can see how we can use biology to enhance the oral cavity and make sure that it's running on all cylinders and optimized levels. Remineralization, I touched up on that a little earlier. There's something called MI paste. MI for minimally invasive. What happens with this paste? It's an edible paste that's derived from casein, which is a peptide or a protein that's found in milk. If you're truly allergic to milk, you can't use this product. Or if you're vegan, you probably don't want to use this product because technically it is derived from an animal product. It has no lactose, so if you're lactose intolerant, you can still use it. It's edible, right? And it basically has calcium phosphate. What does that do? It's these amorphous boulders, right? Different size boulders of mineral or calcium that immediately increase alkalinity, which is healthy. It decreases sensitive teeth. It strengthens teeth. It reverses and remineralizes teeth, so you reverse these cavities. And it's just a great way to increase your alkalinity in your mouth. Xylitol is another great product. Xylitol is a naturally found sugar that cannot be metabolized by these harmful bacteria that cause cavities. So what does it do? It increases your salivary flow, naturally bathing your teeth in saliva, which inherently has protective properties. It has calcium, right? Your saliva has calcium, so now you're introducing more mineral in your mouth, and it basically kind of modulates the environment in your mouth. I'm a huge fan of fat-soluble vitamins, and you see some of them here. Vitamin K, vitamin E, vitamin D. Those are fat-soluble vitamins that are super necessary for your mouth. Gums, bone, connective tissue, teeth, immune system. And then water-soluble vitamins such as B and C are also equally important, not only for your immune system, but in your mouth for connective tissue. Ozone is a naturally found substance. It's basically O3. Oxygen that we breathe is O2. If you electrically introduce another oxygen molecule, now you have O3. So we have a machine in the office that produces ozone. You can have a machine in your home that can create that. And how would you use that? You can actually ozonate water. So now you have water that has ozone in it. And ozone is a great way to modulate that flora in your mouth and create a balanced oral flora. What do I mean by that? Ozone kills bacteria, kills fungi, kills viruses, but it does nothing to eukaryotic cells. Eukaryotic is good human cells, right? Natural cells. So it kills all the bad things, but not the good things. Hydrogen peroxide is another great product that you can use, and we have it in the medicine cabinet as we speak. So hydrogen peroxide is H2O2, and it breaks down to H2O and O2. So it breaks down into water and oxygen, harmless. So if you're prone to gum infections, if you're prone to having bad breath, I would want you to use something like that, because now you're oxygenating the area and you're decreasing those bad bacteria, those anaerobic bacteria. So if you make your own little slurry, you can actually make your own toothpaste. Hydrogen peroxide, essential oils like peppermint or eucalyptus. You can put some baking soda in there, and you can put some coconut oil. And now you created this toothpaste that has all good things, all natural things, increase your healthy bacteria in your mouth, modulate that flora, polish stains, and create healthy, clean breath and healthy, clean gums. Biologic treatments such as platelet-rich fibrin are absolutely remarkable. Think about this. If we draw some blood and we spin it with a specific centrifuge, we separate red blood cells, which are not really useful for tissue repair. Red blood cells are good to carry oxygen through the rest of the body. So if I can separate the red blood cells and just create this platelet-rich fibrin, fibrin is basically the lattice work with all these chemical goodies that speed your healing capacity. So I can really concentrate your healing capacity and move it around to where I need repair. For example, if you're having some bone loss or some defects around teeth, I can repair that and guide your body to regenerate. So you have that regeneration potential. I can harvest it and modulate or move it around so that you can speed up your healing and repair any damaged tissues. More along the theme of biomimetic technologically advanced treatment, is orthotic appliances. We spoke a little bit about TMD, or temporomandibular disorders, when your TMJ is in imbalance or not in harmony, when you're having spasms, muscle spasms, and you're grinding or clenching your teeth, you're having headaches that can radiate to your temples or your neck or your shoulders. We can identify the source of that imbalance and create this mouth guard that basically gives a neural feedback to the brain saying, calm down. How does that work? Well, if you ever catch yourself biting on a fork, without noticing it, you have like a reflex and you open your mouth. There's literally a nerve feedback loop that goes to the brain that says, hey, you're biting on a fork. If you keep on clenching, you're going to break your teeth. Relax those muscles that are clenching and activate the muscles that are opening your mouth. So that's that reflex that I want to encourage, to deprogram these muscles and not allow them to do this imbalance and clenching that basically will create a cramp around your teeth and your muscles rather, and you wake up with a headache or with sore muscles. So these orthotic appliances can be very, very effective, but they have to be made professionally. I wouldn't recommend that you get something over the counter because you can't really control exactly where it needs to be. But there's other appliances that we use for sleep apnea. These are very effective devices that advance your lower jaw forward. Your tongue is attached to your lower jaw. So in essence, you're bringing your tongue forward, as you see in this picture here. When the tongue is forward, you're opening up your airway. So as you're breathing, you're getting more air in your lungs, and without using a CPAP, you can get more oxygenation, you get a more restful sleep, you have no snoring, and more oxygen into the rest of your body. When we do have to remove these mercury fillings, these old mercury fillings, we have to use a specific protocol. It's called a safe amalgam removal, which includes a couple of different things. Like you see here, a dam or a barrier. It's a latex-free barrier. You have to have some oxygen so that you're not breathing the vapors. And then we use a detox protocol of chlorella, activated charcoal, and bentonite clay to chelate and detoxify. Lasers have been used in medicine, but for the past 10, 15 years, they've been very effective with dental treatments. For example, we use advanced root canal treatments with three-dimensional disinfectant. When you're disinfecting these teeth, you have to use a couple of different things. Ultrasound. So now you're bubbling this disinfectant, this fluid disinfectant, and you're having a three-dimensional clean. Or a laser, photo-induced photoacoustic streaming. So it's not just me going in there with a hand instrument. I'm doing a three-dimensional cleansing that goes literally a centimeter beyond of where my probe goes. Lasers are also used for gum treatments, and they're very, very effective. They're also used as a biostimulation device where you're recruiting immune cells to speed up the healing process. Computer-aided design, computer-aided milling has been used in architecture and building or manufacturing parts, like car parts or other devices, but now we are using it in dentistry. And it's a great way to conservatively and precisely create restorations, biomimetic restorations with a very quick turnaround, many times in the same day. So what if you need a very, very large filling or a crown, like a cap that goes over the tooth? You can do that oftentimes in the same day with the use of these computers. So most of the time, I do not use impression materials anymore. Many of you have had impressions of the mouth where you put this putty material in the mouth. You have to wait about 2 to 5 minutes. How cool would it be to have a probe that goes into the mouth like a camera without having this impression material? This is very good for people that are claustrophobic or people that have a very exaggerated gagging response. Let's face it, many times some teeth have to be removed. And many of us right here on this Zoom call have had one or more teeth that have to be removed. And dental implants is like a third set of teeth. You have your baby teeth, your adult teeth, and then you have dental implants, which makes tooth replacement very, very successful for proper hygiene, maintaining your vertical dimension of your face, making sure that all your teeth are nice and straight and properly functioning so that you can chew efficiently. And with the advent of that three-dimensional cone beam CT that I was telling you about, and the scanner that I was just mentioning, you can actually do virtual surgery where you can create a digital guide. You have a three-dimensional guide that you place in the mouth, and you guide the placement of the implants precisely with minimal to no discomfort. Many times we can align teeth without using braces. Sometimes patients never had braces and they want to straighten their teeth because their bite is not proper or their teeth are not properly aligned. Sometimes it's because of aesthetics. Other times it's because we can't keep gums clean enough because they're so crooked that we can't access them. Sometimes patients had braces, they didn't wear the retainers and the teeth shifted. Well, with clear aligner orthodontic therapy, we can go from something like this to something like that in as little as 6 months. And it's a very easy and painless way of doing it. The only drawback is that you have to wear these appliances throughout the day. The only time you take them out is when you eat or when you brush your teeth. But it's a great treatment modality that does not involve braces or metal wires. Many times patients are so deathly afraid of the dentist that they will avoid proper care for 10 years or more. For those patients, we have sedation dentistry. And when it comes to sedation dentistry, we have different levels. It could be as easy as a pill. It could be as easy as nitrous oxide, which is otherwise known as laughing gas or sweet air. Or it could be IV sedation, where we start an IV and patients go to sleep and we take care of years of dental neglect in as little as one visit. You know, it could be anywhere between 1 to 4 hours, and we can take care of multiple issues quickly, efficiently, and painlessly. When I think of oral optimization, I think about all these things that you see here. In my eyes, it's about modern oral healthcare, but it has to be customized for each individual patient. There's no cookie cutter approach. Not everybody needs all the things that I just described today. It should be minimally invasive. And it has to be biomimetic because if it works for nature, it really should work for us. One example would be probiotics. And in my eyes, it's about identifying and resolving oral issues such as infections super early, using advanced diagnostics and something like salivary analysis, like we were mentioning earlier. If we can prevent and or manage these chronic conditions, that's the most successful thing for patients. So this way they don't have to worry about their mouth and they can just enjoy life. What I'd like to offer all the attendees today is this limited time offer, which I'm going to extend to the first 6 attendees. And it's basically a comprehensive oral examination, which normally would go for $600. For the first 6 people that would respond, if you call or contact us via email and mention a special code, it would be offered at $60. So it's a savings of $540. And at that appointment, we can do anything that's necessary for an advanced oral optimization consultation. Advanced diagnostics, like I spoke about today, transillumination, intraoral cameras, or salivary analysis, a 3-dimensional digital scan that can help us identify any hidden infections, an enhanced oral cancer screening using that fluorescence machine that I showed you earlier. And as an added value, if we need to use some biologics, I would extend a family courtesy, which is 50%. Whether it is MI paste, that calcium phosphate alkaline paste that we were talking about, or whether it is oral probiotics, which is a great natural way to fight cavities and gingivitis. It freshens your breath and naturally whitens your teeth. Or if you absolutely have to have an antibiotic for whatever reason, you can use antibiotic support probiotics. These are special crafted GI probiotics. This is a pill that you would take, right, during the course of antibiotic treatment. So this way you don't have any side effects from your GI system. Xylitol gum we spoke about. It's a great way to naturally fight cavities, freshen breath, and create healthy gums. So when you do contact us, use this promo code ESI60, and we'll be able to give you this courtesy. I hope you found what I spoke about useful. We'll hang out and go over any questions, any comments, any concerns you may have. My practice is called ESI Healthy Dentistry, which stands for Exceptional, Sophisticated, Integrated. The website is esihealthydentistry.com, and I'd love to hear from you. Just unmute yourself, Alex.
Yeah, no, I got it. Nice to have you. Great job, Dr. Jimmy. Thank you so much. I love the D'Artagnan look. Very handsome. Very handsome. So great, guys. All right. Thank you so much for hanging out with us. I'm going to give away a copy of this book a little later. It's really remarkable direction our healthcare system is headed in, and the opportunities available both for doctors and clients and people who want to live a long, healthy life and avoid many of these chronic conditions that we've been told we cannot avoid them just because we're getting older. So I know it's going to be an inspiring read for you. So do I have any doctors who are here with us? Any health practitioners in the audience? Okay, very good. I know that Dr. Lauren Bramley is a physician. I wanted to see if she'd like to come on here and chat with us a little bit. Lauren, can you hear me? Hello. All right. So let's chat a little bit. So the current model of our system of healthcare is structured to benefit from chronic conditions. So Dr. Jimmy his practice does not accept health insurance. His people will work with you to get you reimbursed, but the way Dr. Jimmy set it up, and there's a reason for this, and I think it's very intelligent. He works directly with his clients, and when the person pays the doctor directly, they are the client of the doctor. When you have some third-party bureaucracy reimbursing the doctor, then that insurance company is the client, not you. So once you develop that relationship with, Jimmy, you want to throw your website into the thing here? Once you develop a relationship with a doctor who truly cares for you and you become their client, then they're going to avoid these perverse incentives. Can we talk a little bit about these perverse incentives that are in medicine, dentistry specifically, Dr. Jimmy?
Sure. There's a couple of examples. One that comes to mind is if we need to do a crown, the insurance company will say you need an X-ray, and you need an X-ray before, you need an X-ray after. But what if you actually don't need the X-ray? Why? They won't pay until you get the X-ray. So now you're overexposing a patient unnecessarily. Conversely, they'll say, oh, well, we'll pay for checkup X-rays. We call them bite wings, every 6 months. Well, what if this patient doesn't have any cavities and they would benefit from X-rays every 2 years? Why would I want to overexpose them every 6 months? But, oh, well, the insurance pays for it. It's kind of like we can do ablation therapy for your heart and take care of your atrial fibrillation, right? Your irregular heartbeat. Well, the insurance company doesn't pay for ablation, but they'll pay for open heart surgery. That's maximum invasion, right? I'm talking about minimally invasive. And one thing that comes to mind is that MI paste. If I can remineralize 10 little areas of tooth scars or the beginnings of demineralization, like the precursor to a cavity, I'd rather do that. But the insurance company won't pay. It's not a lot of money, it's $20. But the insurance will pay for 10 cavities. Okay, let's wait for those cavities to really become 10 cavities and then we'll drill on 10 teeth. That's that pervasive thing that you were telling us about.
Yeah, no, for sure. Irma, would you like to come on here and say hi? Dr. De Silva? Let me know if I can bring you on here, and you'll chat with us a little bit. It'll be fun. So imagine for a second a system of healthcare that we're going to design for ourselves. Like if I had the perfect kind of a healthcare system, it wouldn't be this monstrosity where you're paying a fortune into health insurance. Then the health insurance decides what they're going to pay for and not pay for. And then they decide how they're going to distribute the money that you pay into them. Today, you have the government that mandates many of the things they authorize. So if you have a Medicare or Medicaid, any of these things, the government collects all the money in taxes, and then they're going to allocate that money to different services. Some of those services are necessary. Many of them are absolutely not necessary. And there's a lot of fraud in that industry. So a lot of waste goes, so it's expensive. And ultimately, we don't get the benefit because the only time it comes into play is once you develop a chronic illness. A lot of seniors also use medicine as entertainment. They'll visit 10 doctors over a period of a week just to meet people, So but it doesn't achieve the goal of human optimization. With regular health insurance as well, you have 2,000 governmental mandates, which tell the insurance company to cover everything from abortion to sex reassignment surgery to hair transplants to, they're forcing these things in there. So when you pay your money into health insurance, it becomes diluted and you don't get specifically exactly what you need for your optimal function. So imagine for a second we had a system where you had a direct relationship with a health practitioner, let's say a nurse practitioner, so we make this as inexpensive as possible. The nurse practitioner's job is to identify any deficiency and toxicity based on this integrative genetic solution testing that we discussed. And then over a period of months and the rest of your life, really, to make sure that all of your numbers are optimized. If she finds that a food is interfering with your optimal function and you're eating it on a regular basis, but you're allergic to it and it's creating inflammation in your digestive system, it'll be her job to find that and let you know. Then it'll be up to you whether you want to give up that food or find an alternative to it. And also, this nurse practitioner will be working under the direction of some of the top human optimization longevity experts in the country. So we're going to consult with all of these doctors. We're going to bring them in as experts. And our job will be to keep you optimized for the duration of your life. Dr. Jimmy's job is to optimize the oral cavity. Our job is to optimize your physical self. So we can extend your life a decade or two, and then extend the wellness part of your life as much as possible and condense those diseases of aging into a very tight, small window. So you really enjoy life and you live it to the fullest and you live it to your full potential. I mean, if you had another 10 years of excellent life that we can add on top of whatever you're going to have today, isn't that worth like everything? I think it is. So let's see. Well, do you guys, would you like to ask some questions, some thoughts, share some thoughts with us? I'm just gonna talk unless you have something you'd like to contribute or address or ask. So there's a lot of really interesting things happening in the world of medicine and specifically in DNA research. One of those things, I don't know if you heard of this CRISPR-Cas9, which stands for clustered, regularly interspaced, short palindromic repeats. Palindromic means you can read it back and forth like Bob. And what they're able to do is actually take the DNA of a person and then identify the one strand or that may be contributing to cancer or leukemia or something like that, go in there and kind of like your DNA is kind of like 100 books in a library on a shelf, and they can actually go in there and remove just one letter from a book, from a line, that DNA letter that may be contributing to some cancer or something like that. I mean, the technology is remarkable. I wanted to ask Dr. Jimmy, how does this whole DNA revolution play out in the dental world? Anything coming on the horizon that we might find interesting, exciting?
Yeah, that's a good question. Couple of things. One is host modulation, which is basically kind of like gene therapy for people that have very advanced diseases like periodontal disease or severe like Sjogren's disease, where we can basically stimulate more salivary flow. And the other thing, which is like super exciting, is growing teeth. How cool would it be if we can, utilize your DNA and create a tooth bud, and after 3 months, you grow a natural tooth? We're probably about 50 years away from that being a practical treatment.
That would be excellent. Less drilling and more natural growth. I mean, it makes sense that it's possible because, we grow our teeth when we're 7. We have teeth that are replaced. So maybe it's possible to do that one more time, like exactly. at about 50. Maybe that would be good. You get a new set of fabulous teeth out there.
I wouldn't mind teething for like a year. I'd wait for it, right? We put a little tooth bud in there, and then after a year, you have a natural tooth.
Well, that's amazing. And your practice is unique in the United States. First of all, you structured the relationship between you and the client. But secondly, there was no expense spared in the technology and the aesthetics of the building. When you walk into a lot of dental offices and you got all the magazines piled up on the table, and you got that smell of death and suffering in the air. You really took the great strides to avoid all of that, and the aesthetics are very welcoming. The smells like you come to somebody's lovely home, and your staff is amazing. They're all very lovely and welcoming and helpful. So it's nice to be treated like an important client, a VIP, when you're working with a doctor. So can you talk a little bit about some of the technology that you have in your office? I know you covered a lot of it, but there was one specific thing that was so impressive to me, how you can digitally recreate the teeth, and then have a computer actually mill a cap in like an hour, and you have all that technology there. That's incredible.
Yeah, I'm still fascinated by that. And when it first came out about 23 years ago, I wanted to be on it as soon as possible. And like I said, it's so fascinating that we can actually scan the tooth quickly and design it on the computer screen. And like you said, mill it, or if it's something bigger, like a bridge, send it out and then have it back in 3 days. I use a lab in California, and I just had a patient before we hopped on this call, and it's there already. I mean, they probably started working on it. So to be able to use technology to help our patients real time, I think is absolutely fascinating. And I think it's our responsibility to continue to improve. If you're staying stagnant and you're not perpetually learning and improving and incorporating these new technologies, I think it's a disservice to the patients. And I don't like when people get comfortable. I think we're constantly have to improve and embrace new advances. And it doesn't only have to be technological; it could be biological, right? So there's a lot of Eastern medicine that we've learned from. And like you said, if you walk into a place and you feel like it smells calming, yes, there's science behind it, and it could be a essential oil diffuser. And there's specific essential oils that are more calming than others, right? Lavender being one of them. So depending on what we're doing, if it's something that's more anxiety producing, we might put a little bit of lavender drops into our diffuser. And again, that's low tech, but it's high touch. And I want people to be more relaxed. I want them to be pampered. It's kind of like when you're going to a 5-star restaurant or a 5-star vacation resort, right? What makes it 5-star? It's not just the facility. It's not just the maitre d' at the restaurant. It's not just the linens. It's everything, right? It's the whole experience. And those folks don't settle, right? They're constantly trying to improve and enhance that customer experience. And I think in healthcare, we all owe it to our patients, that's basically our customers, to surpass and exceed their expectations.
You see that's a remarkable attitude, and you don't see that you don't see that attitude in government bureaucracy generally. If you ever had to go to one of those offices to get something done, and you don't see it in the healthcare system that's third-party controlled. So whether it's a government-controlled center or one that's based on insurance, it's really a different attitude, because a lot of these people think that you are a conduit to them being able to get payment from the insurance company or some third-party bureaucracy. And it's a very different experience when you're working with that. Like when you walk into a restaurant and the owner greets you, right? That owner, if he's successful, he knows how to treat you very, very special. So you're going to enjoy the food, but you're going to enjoy the way you're treated as well. So you're not treated like a third-class citizen, And I think that's a big, big, very important part. And you say all the time, you don't have any patients. You have 4,000 friends and family members that are part of your practice, which I think is such an awesome way of working in this world. Irma mentions that she has a case of teeth clinging, and would love to know if there's anything other than the over-the-counter mouth guard that you can recommend that is known to be effective. Irma, would you like to come on? If anybody would like to come on here with us, I'll bring you on and you can just chat in person if you'd like to do that. If you prefer to just write, that's all. That's also fine. But if you'd like to come on here and be a star, we'd love to have you.
But the quick answer to Erna's question is for people that are clenching, an over-the-counter product, it would not be appropriate. And I'll tell you why. It might be too soft, which makes it worse. If I'm clenching, I can't use something soft. It has to be something hard and well-balanced. And the only thing that I can think of is a professionally made appliance. It has to be made correctly, and it has to be made out of the right material for that particular patient. I don't clench, but I grind. To oversimplify it, there's two types of people. There's cows and rats. Cows go side to side like this. Rats go up and down. Rats are clenchers. Cows are grinders. I'm a cow. I grind my teeth. So my teeth, my TMJ doesn't care if it's a hard or soft, so I have a soft one. But someone that has clenching needs something that takes advantage of that feedback loop I was saying, that fork between, if you catch a fork between your front two teeth, that feedback loop. You need something that's hard and well balanced so that it tells the brain, hey, I think there's a fork between your teeth. Don't clench. Relax your muscles. And that deprograms the muscles so you don't clench even when you're not wearing that appliance.
Awesome. Mariella wants to know if there are any special COVID preclusions or measures, if there are any COVID. There are a lot.
Yes, right. So a couple of things that we've incorporated. Now, dentistry as a profession, I mean, we always would wash our hands. We always would wear gloves and masks, but we wouldn't do it when we were talking to you. Now we wear them all the time and we wear double masks. But one thing that I incorporated, which I think is really great, and some people think that I went overboard and it's too much, is I figured out what they use in ORs, operating rooms, when they do very sophisticated surgery. And they have to have what they call surgically clean air. And they have these big towers that constantly suck up the air. And they have a HEPA filter. And whatever gets out of that goes into this UVC chamber So the HEPA filter will filter at 99%. That body of air will go through this UVC chamber, which will zap everything, and it circulates the air. So every 6 minutes, you get clean air, but it constantly works. And I'll tell you, I felt better. I felt that the air was so clean. I mean, I just felt lighter and more focused, more refreshed. I didn't feel tired. I felt more energetic. Me as a provider, as a worker, so to speak, right? And the whole team felt it. So you can imagine if we feel it, we're in that place for 12 hours, you know it's really, really good for patients. So every room has one of those units. And again, my colleagues think I'm crazy because each one of those units is $2,000 and I have 10 rooms. But if it's good for my patients, it's good for me. And it really just makes me feel more comfortable, and it's just a cleaner, healthier environment. So that's one of the things that we incorporated.
That's awesome. Nada wants to know, root canal treatment you mentioned, does it mean that pulp will be removed or it can recover after treatment?
Nada, thank you so much for your question. I'm very passionate about this, and I'm going to give you the 1-minute answer. I could probably be talking about it for like 3 hours. Couple of things, and I actually completed a case today. If you can avoid root canal, that's really your best bet, okay? So sometimes you have decay and it's very close. There's many different things that we can do to carefully remove the decay so that we don't expose the pulp, right? And if all the stars are aligned, we can use ozone, we can use minerals, we can use special caries removal devices, right? To detect how far, how deep we can go. Sometimes when we're really, really close to one spot, we will allow that decay to stay there, and we'll put layers of medicated material to reverse that, and then just put a regular restoration over that. So the key is avoid root canal. If you absolutely have to do it and there's nothing I can do, it's in there and your nerve is infected, then the whole thing has to come out. If it's traumatic and it's a young individual that has regenerative potential within that pulp, then you're right, you remove the top portion of it, you put another layer, you leave the bottom portion of it, and you're guiding the body to continue to heal. So there's 3 different flavors, right? Prevention, definitive treatment, and this in between that we do, but only few individuals are good candidates for that latter one.
Awesome. Great. I think we answered all the questions here. So I think we did a great job. Honestly, I think we were passionate. We shared everything we could. We were authentic, and we try to communicate as much as we can based on what we learned together. And I appreciate you guys being here. So if there are no other questions, first of all, Dr. Jimmy, you want to pick someone that we're going to give this book to?
Well, I would have to pick the one person that was constantly engaging and giving feedback and asking questions, although we had a couple of really fantastic questions, but if I had to pick one, it would be Erna.
Great. I'm going to send you my email, Ara. If you could email me your mailing address, I'll get the book out to you right away. You're going to love it. It's really a great read, very fun, very interesting. All right, Dr. Jimmy, any final words of wisdom that you'd like to impart?
Yeah, first I want to say you guys have been such a great crowd, and I'm really happy that you joined us tonight. I'm excited that you guys got a lot out of it. I feel like you really did, and please continue to do that. It seems like you're very well versed with healthcare, and you care about your own healthcare. Keep doing that. Continue to do that because you're worth it. And don't take no for an answer. Do your own research. Take care of your own health. Be in control of your well-being because it's up to you. It's not your doctor's responsibility. It's your responsibility. So I would take responsibility for your healthcare. That's
brilliant. I think that especially this has been a really difficult couple of years for so many of us, and we've been challenged like probably we've never been challenged before. But I just wanted to say that a lot of times we'll look at the world and we'll see a beautiful mountain and we'll say, wow, what majesty. We'll look at the ocean and we'll say, wow, what power. We'll look at a beautiful field of flowers and we say, wow, that's magnificent. But sometimes we look in the mirror and we don't see perfection. But I just want to tell you that you are much more powerful than any ocean, much more magnificent than any mountain, and much more beautiful than any field of flowers. Whatever you need to do to enjoy this life fully, you're worth it, and you're worth the investment that you need to make to achieve that. So on behalf of myself, Dr. Jimmy, I want to thank you so much for joining us. You guys are awesome. We wish you great health. Feel good. God bless.